the 1600s guy Wu Youke, or also called Wu Youxing. He talked about plagues as being this freakish pathogen that's not cold, not wind, not all the normal things. And then he says it's not something that comes in from the pores. It's not that. And it doesn't affect the younger or old. It affects the people who are already very healthy.
I'm Michael Max, and this is Geological, the podcast that curates East Asian medicine and methods through the power of conversation for practitioners of the art so that we may better help our patients. I was talking with a friend the other day. She was telling me about something that she'd heard on a podcast that really bothered her. Bothered her enough that she kept hitting rewind to listen again and again to the portion of the conversation that raised her anger. My first thought was, why would you torture yourself this way? And then I realized I do it as well, all the time. The thing that triggers or angers me, the tone of voice somebody used with me, the thing they said, or even worse, did, that caused some trouble to arise in me. I can't let it go. I think about it. It skips through my mind like the scratch on a vinyl record. My story machine spins up damned good reasons for why I'm right. I will go endlessly at something that fans the flames of my indignation, hurt, or pain. And here's the strange thing when you think about it. How often do you hit rewind on a podcast or reread a paragraph that brought you a moment of illumination, joy, or connection? Does this sound familiar to you? Perhaps it is hardwired into us humans to attend very closely to something that might be a danger or a threat, and we easily ignore when the world shows up as beautiful and connective. Maybe this is why gratitude requires actual, attentive, and focused practice, while anger, resentment, and frustration can easily run amok without the intervention of our attention to dial them down. I know, and I suspect you know as well, that in this particular moment of time, sharing your feelings and thoughts can be fraught with the peril of misunderstanding, vociferous disagreement, righteous indignation, or cancellation. It's a trouble of our times that we can take as an affliction or as an assignment. I try to come down on the side of assignment. So there might be times you hear something on Geological with which you strongly disagree. And fair enough, because our profession is made up of all kinds of different people with differing points of view. My job with the podcast is not to censor or correct my guests into alignment with any particular perspective or ideology. My job is to hear what they have to say. Because these podcast conversations are unscripted, because they are genuine, real-time discussions, we most assuredly may tread into controversial territory. I'm not attempting to stir controversy, but then again, I'm going to do my best not to tiptoe around it, should it show up. I suspect the way forward through these disagreeable times is to better develop the capacity to listen to others, especially those with whom we have disagreements. It's easier to aim at being right than to aim at understanding, but it's the gongfu of aiming at understanding that holds the potential for taking us forward. I fail at this on a regular basis, but it still seems worth aiming at. And I would encourage you, when you hear something somewhere, be it a podcast, a passage in a book, something that streams across one of your screens, something that lands with the feeling of truth and beauty, that you hit rewind for a time or two so as to allow it to sink in. We are living in troublesome times, incendiary social change, plagues, and political upheaval. It's not hard to have your nervous system a notch or two above overload. And all the more reason to do what you can to settle your spirit and give some attention all the ways, the world is working just fine. We are better able to create the changes we want to see when we are working from our strength instead of from our stress. Today's conversation is the first in a series that we'll do this month on COVID. It was 3 years ago that our world ground to a halt with the fear and increasing infection rates of COVID. It's been quite a ride these past 3 years, and as the coronavirus goes from being novelly frightening to part of the seasonal endemic mix, we are now challenged with distilling the lessons learned from COVID and to consider how we might respond to future global scares. Over the next 4 weeks, we'll be discussing the experience of the past 3 years as a way to pause and reflect on the troublesome times that we've just lived through. In this conversation, I will be talking to Daniel Altschuler, who is an herbalist and acupuncturist who lives in one of the ground zero cities of the pandemic, Seattle, Washington. Our conversation with Daniel is coming up right after Shop Talk, the clinical nuts and bolts portion of the digital campfire here. It's all practical material on treating patients using acupuncture or herbs, along with a smattering of the how-to of running that fantastic machine for social good and change, your practice. But first, a word from the folks who make it possible for you to enjoy Qiological. These conversations come to you through the generous support of our sponsors and members. Blue Poppy, your new one-stop shop, has speedy shipping options on everything that you need for your clinic. It's Women's Health Month at Mayway Herbs. Check out their new website for learning resources on helping women with herbal medicine. Are you a creature of habit? How about making a change that helps your patients and the planet with AccuFast needles? And later in the show, raising your fees doesn't have to be a difficult process. Jane has helpful suggestions on making it easy and effective. And finally, have you considered that having a thriving, profitable practice is one of the most healing things that you can do? Julie Bear-Don't-Walk has, and she can help you do something about it too. Do be sure to visit the sponsors page on the Qiological website to take advantage of all the special offers our terrific sponsors have for listeners of the podcast. Picture this. Your clinic is buzzing with patients, and then you realize that you're down to your last box of needles. No need for panic, because Blue Poppy, your one-stop shop for all your acupuncture needs, they ship orders received before 3 p.m. on the same day. With a quick visit to Blue Poppy's website, you can order premium needles, herbal formulas, and that special Dr. Bob's oil that your patients love. Blue Poppy understands practitioners can't keep patients waiting. That's why they strive to get you what you need when you need it. From high-quality Chinese herbs and formulations to acupuncture supplies and clinical essentials, Blue Poppy has served practitioners for nearly 40 years with products that meet the highest of standards. Discover everything Blue Poppy has to offer by visiting www.bluepoppy.com, and don't forget to subscribe to their mailing list for exclusive offers and more.
Hi folks, I'm Yvonne Lau, president of Mayway Herbs. May is Women's Health Month, and as a women-owned and women-run business, we especially love how Chinese medicine can support wellness through every stage of a woman's life. So in this month's newsletter and podcast, we're covering topics like PMS, pregnancy, menopause, and osteoporosis. We'll share expert insights and effective treatment strategies you can put to good use in your clinic. Our Plumflower brand line includes herbal tea pills, tablets, extract granules, and organic herbs, all of which you can find on Mayway.com. And where you can also find articles, videos, and other resources to support your practice. Since 1969, Mayway has been a trusted source for high-quality herbal products. In these challenging times, please know that we remain committed to keeping our products accessible and affordable so you can take care of yourself and your patients. As always, thank you for supporting real Chinese medicine.
Daily habits and routines feel comforting, familiar, easy, automatic. That's the power of repetition. You've worked out the kinks and can do it with your eyes closed. But what if you shook things up? What if you ditched the old routine and tried something new? Hi, I'm John Sten. I've practiced acupuncture for over 30 years, And together with my wife, Kelly, we created the world's first eco-friendly acupuncture needle. The AccuFast earth-friendly needle system cuts your packaging waste by 60 to 90%, depending upon your needle type, speeds up your needling, gives you more control, and best of all, while you're healing patients, we plant a tree for every 2 boxes your clinic uses. Thousands of acupuncturists have already made the switch. In just the last year, they've helped plant over 16,000 trees. Since we started, that number has grown to over 50,000. So break the routine. Be the change. Visit AccuFastNeedles.com. Your patients and the planet will thank you.
Daniel learned his Chinese medicine apprentice style in Taiwan, so not only did he get a wealth of deep experience with his teacher there, he also had the opportunity to put the formulas of the Shanghanlun and Wenbing to work in treating the seasonal infectious diseases that run rampant in Southeast Asia. He's got a few things to say about the pandemic and herbal medicine. We'll be getting into that shortly. Welcome to Shop Talk. In this portion of the podcast, we are bringing you roughly 15 minutes of practical, clinical methods, perspectives, and advice that has its work boots on. This section is all about practical material that you can begin to investigate the next time that you walk into clinic. Additionally, visit the show notes page for supporting materials from this week's guest on Shop Talk. All right, roll up your sleeves. Let's get to work.
Hello, this is Kristen Wisgerda in Massachusetts with a SOM case study from my practice. I've been practicing SOM acupuncture since Toby Daly started teaching it, and I'm now teaching in this tradition. I hope this case will inspire more acupuncturists to study SOM, while I also hope that it will be interest for those who are already practicing SOM. In 2019, a patient came to me for a return visit. She was jubilant because she had been discharged from the wound care clinic she had been attending twice weekly for over 2 months. The wound had resulted from a fall 2 months prior when she scraped her left shin. 2 weeks before her jubilant visit, she came to see me complaining of fatigue and wooziness in her head. And oh yeah, she also had this giant wound on her leg. It was all wrapped up during that visit, but she showed me a picture that had been taken the day before. The overall wound was 8 inches long and 3 inches wide. It had kind of a purpley bruised look with some redness on the periphery. In the center was a 4-inch by 1-inch area of exposed, moist granular tissue that hadn't epithelialized. I treated her with SOM-style acupuncture that day. When she went back to the wound care clinic 40 hours after acupuncture, so less than 2 full days, the open area of the wound had fully closed over. The clinic had been preparing to use placenta tissue on her wound as a last-ditch treatment because the standard treatment just wasn't helping. Now they had no need to do any treatments, and instead they discharged her. The doctors and the nurses all commented that they had never seen such a big change in a wound in 3 days, but that it couldn't possibly be from acupuncture. My patient is convinced that they are wrong, and me too, since I've seen acupuncture, especially SOM-style acupuncture, produce very dramatic treatment results very quickly. SOM is a Korean monastic tradition of acupuncture, and it's organized around the 12 primary channel systems. These channel systems include the channels and their respective organs. The 12 channels are described as carrying particular elemental qualities in a way that synthesizes their yin-yang, 5-phase, and 6 conformation qualities. Particular relationships among the channel systems outside of the way they're usually organized in yin-yang, 5-phase, and 6 conformations. So these particular relationships are seen as being crucial for health, but also the cause of pathology. These relationships are one of counterbalancing. So these 12 channels are broken up into 6 channel pairs. So for instance, in one counterbalancing relationship is between the heart and the urinary bladder. The heart is yin double fire, as it's of the water phase in Shaoyin fire. And this double fire is seen to counterbalance double cold water, because urinary bladder is yang double cold, it being of the cold water phase and of taiyang cold. The other 5 channel pairs are gallbladder paired with pericardium, liver paired with sanjiao, kidney paired with small intestine, lung paired with stomach, and spleen paired with large intestine. What I love about this style of practice is that it demands that you have an intimate relationship with elemental qualities and directional movements, dampness and dryness, hot and cold, consolidation and dynamic movement, up and down, dark and light, internal and external. You have to know how to recognize the way that all of these play out in the dynamic complexity of a living system. Because with each SAM treatment, you are using 4-point needle technique to strongly add these qualities when they are deficient. The power of the system means that when you diagnose and treat correctly, results can be amazing, as with my patient. But the other side of the coin is that incorrect diagnosis and treatment can lead to adverse events. What I also love about SAM is that it's strongly observation-based. We look at skin quality and coloration and markings. We look at people's hair and their symmetry and their eyes and their hands and their heels and their posture and their body shape and size, the quality of the flesh. We look at their socioeconomic status, and we also look at their sex appeal. So everything's a potential pointer to the channel imbalances, creating health or creating pathology. The observational nature of SAM has me deeply appreciating humanity in a new way. It's required that I check my judgments at the door and really try to see these elemental qualities in my patients. Like, none of these qualities are good or bad. There's just too much or too little of certain qualities, and all of these qualities are essential to life. Toby Daly often describes SAM as love medicine. I can attest to this and tell you that this practice has enriched my life by really enhancing this appreciation of humanity. So back to my patient. How did I help her that day? The first clue is that her wound was squarely on the stomach channel. In SAM, channel location means that we must look at the state of that channel system, in this case stomach, and the state of its counterbalancer, in this case, the lung. So even though we often treat channel pairs other than those where the problem manifests, we look beyond the channel location when qualities other than the channel are the more prominent part of the picture. For this situation, both the channel and the quality of the problem and the overall condition of the patient told me that the counterbalancing pair that included the stomach was the problem area. So in this case, we need to look at both stomach, the channel and the quality, and lung, the channel and the quality. So lung is yin, it's dry metal, and tai-yin, dampness. So it has the combined qualities of metal dryness and tai-yin dampness. These manifest as a dry exterior and a damp interior, but also a capacity to gather qi and resources and create a firm inflation through the body, like a balloon that has plenty of air to fill it out, so the surface is firm and the balloon is buoyant. When the lung is excess, the skin is too dry and the body is too fat and kind of too overfull, like an overinflated balloon. The voice can be loud because there's such an accumulation of qi that just kind of comes out. The patient has an overabundance of qi and dampness that often create symptoms of stagnation. Stomach, on the other hand, is yang, earth dampness, and yang ming dryness. So the damp and the dry are in different locations, and belong to different aspects compared to the lung. So when stomach is in excess in relationship to the lung qualities, the patient presents with a damp exterior and a dry interior, and a tendency to not accumulate dampness in qi in the interior. So we could say kind of an interior deficiency or a lack of ability to hold on to resources. Besides having moist or sweaty skin, that dampness on the exterior, in less than normal amount of body flesh, kind of a skinnier presentation, stomach excess patients will have soft voices. The balloon of the body is deflated and lacks the qi and resources to fill out all the way to the surface. So in Sam, there's a saying, sometimes channel and sometimes quality. We already know that the stomach channel is where the problem is manifesting. Let's look at how the quality of the problem area and the qualities of the patient present as an imbalance of the lung and stomach channel pair. So my patient with this wound was 73 at the time. She was about 20 pounds overweight with thin and fragile skin that was extremely dry and flaky. Her surface was also remarkable for a thin layer of fluid just under the skin throughout her body and extensive purpura. Her legs were also mildly edematous on top of this extra fluid under her skin. And her legs were also full of very fine varicosities. They often felt achy and sore to her. For all of this extra fluid and weight, the balloon of her body seemed more deflated than overinflated. So more stomach quality than lung quality. Her thenar eminences were also deflated, but her chest wall was of normal size. The chest and thenar eminences are important areas for evaluating the state of the lung. Her voice was soft and weak, and her abdomen was soft and squishy. She was very chatty, but kind of caught up in her own to-do list and other people's problems. She wasn't especially hot or cold. Her chief complaint had been tiredness, but not the wound. She has to limit fats, otherwise she'll have diarrhea. She's an accountant who was still working 20 to 25 hours a week, and she was attending exercise classes several times a week and also tending to her ill sister, which was a big expenditure of energy for her. By nature, she's a big pushover who continues to see clients who annoy and exhaust her, even though she would be well off without the extra money. She felt better with 9 hours of sleep, but would only get 8. Other complaints during that visit included wooziness in her forehead, kind of an off-balance feeling that she denies needing to stabilize herself and sit down. So here's a simplified analysis of her symptoms according to Sam. And I'm only highlighting the aspects of her presentation that for me had the most clinical weight for her situation at the time. And we really need to, the grossest thing in the room was this wound. So we really needed to focus on the dynamics that were creating the wound. So the presence of the stomach channel gives weight to both lung and stomach involvement. So that has equal weight for both lung and stomach. Even though the problem is on the stomach channel, we give lung as much attention as the stomach in Sam. Lung energy manifests, again, with dry skin and extra body weight and good resources. And she had all of these aspects. So remember, lung is dry metal on the surface and damp tie-in on the interior with an ability to accumulate qi and resources. So she had plenty of exterior wealth. She had plenty of money and was very comfortable financially. So a snapshot might have had us thinking that the lung could be in excess here, but we have to look at the state of her stomach energy to see the balance between the two. So for her stomach energy manifested as dampness on the exterior, showing up with the moist, open wound. So because of the dramatic presentation with this wound, we give it the most clinical weight. Like, this is the problem right here. We can't get distracted by other things. Other manifestations of her stomach energy are her soft voice and her deflated body and thenars. Weighing the balance of lung and stomach qualities, the stomach qualities for her are more dominant. So we can see that the imbalance is of stomach excess and a relative lung deficiency. So the magic treatment that healed her wound was supplementing this relatively deficient lung to counterbalance the excess stomach energy. Lung bringing dryness to the exterior and resources to the interior. The resources that lung brings to the interior are moisture, but more importantly for this case, qi. Supplementing lung blew up her deflated balloon so that qi could get all the way to the surface, bringing everything her body needed to heal that wound lightning fast. The fluid under her skin could be considered either interior or exterior. In this case, I choose to think of it as exterior. Her low energy could also come from lung or stomach excesses. Too much stagnant qi or not enough qi. Too much stagnant qi is qi bound up and not available to the system. And then deficient qi is also obviously qi not available to the system. In this case, other signs pointed to a stomach excess, internal emptiness, rather than a stagnant lung excess. Not only did her wound heal, she also reported a big lift in her energy after this treatment. And I still see her every month or two for a variety of conditions, or just a tune-up. If you're interested in learning more about SAM, I highly recommended the resources here on Qiological, especially the Introduction to SAM taught by Toby Daly. Toby's class provides you with the foundation needed to practice SAM. SAM seems simple, but it really is very sophisticated. Its strong power must be used with great caution. Don't try this at home until you have taken Toby's class. Qiological also has other free and paid classes on SAM taught by Toby Daly, and I recommend all of them. As Toby's teaching assistant, my offerings include a very active subscription SAM mentorship forum on the White Pine Circle. I also taught an eye observation class that is SAM specific, and this is available on demand on Qiological. My latest course on Qiological is the upcoming 12 Channels of SAM, which will begin in April 2023. The prerequisite for this class is Toby's intro class. This 12 Channels class takes the information from Toby's intro class and provides a deeper dive into these foundational materials. So we delve into how to better identify the most essential elements of the channels. Learning to assign clinical weight is key to correct diagnosis and also makes the process so much easier. This will be a very clinically oriented class. A private forum will keep the conversation going between classes, and it's also a place to ask questions, even if you can't make the class live. Please look to the show notes for more information for all of these resources. I hope you will join me.
Daniel Altschuler, welcome back to Qiological.
Thank you, Michael. Good to be here. Thank you for inviting me.
It's been a while. I think the last time we were together on Qiological was at close to the beginning of this pandemic, the beginning of the plague years. Weren't you on one of our panels where we were at the very beginning talking about, like, what is this thing and what do we do about it?
I think I was on pre-Qiological, actually, your first iteration of this.
Yeah, well, I know you were on that, Everyday Acupuncture, but I think, look, I own the damn show. I should know if you were on or not. Look at me. I'm terrible at doing my own research.
I can't remember what I did yesterday, but it's this amazing show that you have, and it's just so much information. I hear my students talking about what they learned from your programs all the time.
Really? You think I should charge them for it? Maybe I'll get some tuition money. Anyway, in all seriousness, this is the month of March when this airs. It's all COVID all month. It's March COVID madness here on Qiological.
I love it.
It just seemed like a good time to come back and, look at where we've been, look at where we are, where things might be going. Again, from a Chinese medicine point of view. And I mean, look, in school and even outside of school, we all read Shanghanlun, or at least heard of it. We've heard of the Wenbing. We know that we're supposed to be famous in Chinese medicine for treating pandemics. And then an actual pandemic shows up on our doorstep. And I think I kind of want to do a post-mortem. Like, how did we do? How do we do at the beginning? How do we do in the middle? What are we doing now?
That's a really interesting question. And I have taught Wenbing in the States since I moved back here in 2006. And it's been a class I've taught at multiple Chinese medical colleges. And I've also taught infectious diseases a few times, a class that was devoted to how to treat Chinese infectious diseases with Chinese medicine on the field, how to recognize. So every time I taught these classes, they're all very much about talking about epidemics and plagues and things like that. And Chinese medicine has so much to offer. But the students just kind of look at me with a little bit of interest, but also with a complete disconnect because they live in just such healthful comfort, other than the cold or whatever. And so once this pandemic hit, now I teach the course and everybody's like, I get it, So it's very interesting for me as an instructor, the shift in how I can convey this information and people, they just completely get it.
So when you're teaching methods for the kinds of illnesses that are, let's call it, relegated to history, at least in a person's experience, because they haven't gone through it, not so interesting. Like, that's an interesting historical artifact. And so you're not that interested. Like, why should I be interested in that? We don't have that. And then, of course, after you've lived locked down or whatever for a while, or notice people around you being very, very sick, maybe even dying, totally get your attention in a different way.
For sure. I think for me, before this pandemic hit, I was living in Taiwan and I was there during the SARS epidemic in 2003.
No, that was nothing compared to this.
Well, I was in ground one or something, however they term it. It was also from Guangzhou, China, and then it hit all the Asian countries.
I remember that. I was in Beijing.
You were in Beijing, so even more. But Taiwan had quite a few deaths and they had quarantine hospitals set up. It was just the whole architecture of how it was organized by the government and all the chaos as well, all the fear. I lived right through that. My daughter was born in one of the quarantine hospitals.
Was she at a Koping hospital?
No, not that one. She was at Sanjunjiang the Tri-Services Military Hospital. Because I did a lot of work there, we decided to use that hospital. That was one of the quarantine hospitals. The Heping was the one that was shut down.
It was a big disaster.
That's right. That was doctors were running out the windows when they shut that down. It was very interesting.
So let's start with SARS-CoV-1, right? Back in, was it 2003, 2004?
Well, I remember it was probably 2002 when it was started. And then 2003 was, my daughter was born in March. So it was like right in the middle of it. It had been going on for a long time before that in China, before it was announced to the world.
I remember being in China for the Chinese New Year, right? Guonian. And I was headed down south with a friend to travel. We were going down to Yunnan. I remember being on an airplane and reading the newspaper. I'd just gotten to the point where I could actually read a newspaper in Chinese. So I'm like practicing my Chinese. I'm reading the newspaper. And I remember thinking, okay, either my Chinese still really sucks because I'm not understanding this, or there's some heavy shit happening in Guangzhou right now. And it turned out there was some heavy shit happening in Guangzhou.
Yeah, I was taking a class for my PhD program, and we had a professor from Guangzhou come in and teach. It was a group of Taiwanese doctors doing this together. And we were all in this class, and he was talking about some weird stuff that was happening, and doctors were running to the hills in the country and, all this kind of stuff. And we looked at each other like, what is he talking about? And about 2-3 months later, it burst open. So it had been smoldering for quite a while, I'm sure.
Mm-hmm. These things tend to. Now, so yeah, let's talk a little bit about the SARS epidemic, which, was a big thing if you were in Asia. How were you looking at it and treating it at that time? You were working with Dr. Lee, and he's a guy who's not going to shy away from a fight on this one.
It was very much locked down. If you had any fever or cold, you were sent immediately to one of the quarantine hospitals. There was no access by Chinese doctors at that time. So there was actually no exposure of this disease, I mean, in a medical way, by Chinese medical doctors. So there was nothing actually. And Taiwan had such a good system set up very quickly that it did not spread really through the population, I mean, in a big way. So actually, it was there, and I experienced it as a citizen, so to speak, but not medically.
You didn't get a chance to treat it. The people you were studying with and Dr. Lee, were you talking about it in terms of Chinese medicine? And if someone you knew got sick and was not in a hospital, what you'd do?
I do remember taking a walk with Dr. Lee around the local campus, the university campus nearby. And I was talking to him about it. And whenever you're next to him, he's always talking formulas. If you're eating food, he's talking, what the food on the table will do to you or for you, So we were chatting a little bit about the SARS. It was quite interesting because typical pattern was 4 or 5 days before the onset of the big fever in the lungs and all that infection or inflammation in the lungs, the patients would experience diarrhea, and then it would move into like a lung issue. And so it was very much this large intestine heat, moving to the lungs type of thing. And, because we're Dr. Lee and my own interest in how I see diseases typically comes out of the Shanghan Lun. So we were, I think, Gegen Qinian Tang and Gegen Tang types of things were where we were, what we were discussing and what we thought would be the best ideas for this.
So you were seeing as an attack to the Yangming, not to the Taiyin spleen, but to the Yangming large intestine.
That's true. Yeah, more like, that's right. No, I think lung large intestine as like just a general Zangfu pathology link, so you have heat in the large intestine, it transfers to the lungs. Not thinking in that Taiyin way, but yeah, more like a Yangming heat.
I mean, and fair enough, because you could easily also see it. Well, I don't know if you could easily see it. You could maybe make a case for, it strikes the Taiyin spleen, it loses its regulation, you end up with diarrhea, and then transmits to Taiyin lung.
Although this was less of a deficiency and more of a heat. I mean, I didn't get it and I didn't see the stools, but I think it was more of the heat type of a diarrhea. And then the lungs would just fill up with fluid, get inflamed and get scarred all over, which is what heat. And the people that were most at risk for serious disease and mortality were the healthy people, the younger people, not the young babies or the older people. And that's very typical of plagues. It's the people who have a very robust immune system that tend to get hit more because their immune system overacts and it just destroys themselves in that way.
It's interesting, isn't it, that here's a pathogen. We often think, it's a really vicious pathogen because a pathogen flipping killed these young people. But when you step back and you look at it and go, here's a pathogen, and in young people who are strong, it works this way, and then the person's own Wei Qi, their own immune system, their own Zheng Qi in a sense, their own strength is what kills them because of the overreaction.
Yeah, so a lot of the treatment was just steroids to try to suppress that. And I think they were able to figure out some way to help patients just by steroids, which suppresses the inflammatory process. It was quite interesting in that regard, and a lot of plagues are like that. The 1600s guy Wu Youke, or also called Wu Youxing, he talked about plagues as being this freakish pathogen that's not cold, not wind, not all the normal things. And then he says it's not something that comes in from the pores.
It's not your father's Oldsmobile.
It's not that. And it doesn't affect the younger or old. It affects the people who are already very healthy. So he had a very interesting statement or observation about epidemics and plagues.
I think that pretty much nails it, doesn't it?
I think so, yeah. Which also takes me to another sidewinding point, which, a lot of people, I'm sure, ask me, ask many practitioners. It's like, I'm afraid of COVID. This one, what can I do to boost my immune system? Like, your immune system's fine. You don't need it any stronger. It's not the point. Of course, there are people who are very weak and had, all kinds of stuff, which also obviously were susceptible to having a high risk of death with COVID too, we're talking about. But just a lot of healthy people were also just super at risk. And to me, I wasn't clinically interested in just running around helping people's immune system.
Well, I think this is one of those places actually where we fail as Oriental medicine practitioners, because we so often, with one part of our mind, be thinking Western medicine. And how can we not? Look, if we're Westerners, we can't not have that part of us. That's not something wrong. That's just part of who we are. And we've got this other way of thinking through the medicine that we've learned in practice. It's very, very different, right? You cannot take immune system and map it directly into East Asian medicine. It doesn't work. It just doesn't. And then you have people in the West, and of course, our understanding is our immune system is what protects us. It's the police force. It's the army. It's the good guys protecting us from the bad guys, right?
That's right.
But that idea doesn't work in Chinese medicine.
Absolutely. And it doesn't quite work in Western medicine either in a certain way. I think it's one of these ideas that floats around, in the natural medical world sometimes, or, immune system boosted, the supplement industry, all this kind of stuff is, for me, I prefer to talk about modulating the immune system, which is much more useful, especially in a Chinese medical environment. We want to regulate, we want to modulate, the idea that we're all about tonics and boosting and all this stuff. That's kind of folk medicine. That's for the people who want to live a long life or virility or, all that stuff. But when you're really in the clinic treating diseases, you have to adjust what's too much and what's not enough. And that comes right down to what we do.
This episode is brought to you by Jane, the clinic management software that honestly just makes running a practice easier. Let's dive into something that's never easy, but sometimes necessary: raising your fees. It can feel awkward, right? But here's a tip that can really help. Consider offering flexibility to your patients as you introduce the change. When patients face new fees, it's natural for them to feel uncertain or concerned. That's where flexibility can really make a difference. Offering options like a phased increase, suggesting a payment plan, or even taking a moment to talk things through can help to ease the transition. These thoughtful gestures show your patients that you're listening and care about them, which strengthens the trust you've worked so hard to build. If you're looking for more ideas on how to navigate these kinds of changes, head to frontdesk.jane.app and check out the article, How to Tell Clients You're Raising Your Fees. One last thing, if you're ready to give Jane a try, you can use the code CHIOLOGICAL for a 1-month grace period on your new Jane account. It's really the heart of the medicine, as far as I can tell.
Yes, that is our strength. You talked about our weakness, which is exactly right. And I think our strength is the modulation part, regulation.
Agreed. Yeah, there's such a great word for it in Chinese too, right? Tiaoli.
Tiaoli, yes. I love it. Those two words are so full of meaning.
Tell us a little bit about tiaoli from your point of view.
Well, Tiao, the character Tiao, I always like that character because if you pronounce it Diao in modern Chinese, it means rhythm. So, like if you use the word blue, lan diao, it's the word for blues music. So I love all the ways that it's used. But yeah, tiaoli, to regulate, usually it's used for the liver-lung dynamic across this midriff where things are not ascending, descending, or the qi is not flowing very well, which often is, at least now in a kind of a, modern textbook Chinese medicine, is given to the liver. That's the function of the liver. It's not wrong, but it's maybe a little bit too much on the liver in modern day. But that being able to allow the qi to flow in the directionality that it's supposed to, through all the organ systems, I think that's a big part of this tiaoli, at least in terms of how it's understood in the herbal medicine formulas in the textbooks.
Yeah. I would think even in acupuncture to some degree, at least in my way of thinking, and that there's like a multiplicity that encompasses. It's not just I'm turning a knob to adjust, like say, bass or treble. It's looking to more through multiple ways create this modulation and balance. And, I think so often we get caught in these dichotomies. There's too much of something, I'm going to cut something away. Or, like we were just saying, well, I'm worried about getting sick, so I want to boost my immunity. It misses the mark.
Yes.
Yeah, we had a little run-in with SARS-CoV-1 some years ago. I remember in Beijing at that point, you could not buy banlan gun because it was gone.
Taiwan too. It was hoarded.
Yeah, same thing, right? And I think Jinyanhua, you probably couldn't get it. There were a number of herbs, and they're usually the cold, I'm using air quotes here, antiviral from a modern point of view. And what would happen is, it's not because Chinese medicine practitioners were using a bunch of it. It's because the population understands a wee bit of Chinese medicine because they've all grown up with it. So like, oh my God, a viral thing, banlan gun. And like, poof, overnight, it's gone from every single pharmacy because the entire population just snarked it up.
That's right. I think banlan gun I remember very well. Dr. Lee doesn't use it so much in that way, so that wasn't a problem for our clinic. I remember Changju also, it was something that was out there as good for this problem. I think, maybe that was because of the bowel movements, the diarrhea. So Changju kind of has a function for clearing that up. And that's maybe a top 10 herb for Dr. Lee. So he kind of hoarded a bunch of boxes for that. But it wasn't actually, Taiwan was a little different than mainland China. I don't know mainland China's situation in the herbal supply regard, but I don't even know if supply chain was a word back then, but our supply chain was cut off. We're an island nation and the ports shut down. So we had no supply of herbs at all. So, I think probably a lot of the doctors just, ordered as much as they could before there was nothing.
Toilet paper in Changju, you just can't get it.
People act weirdly when things happen like this.
Yeah, well, I don't think we can help it.
No.
En masse, look, as individuals, we can be pretty reasonable, but as groups, not so much most of the time.
And the governments were really interesting too. I remember the Taiwanese government, everybody in charge of each department of the government had to show that he or she was doing something about it. So, like the sanitation department had to increase the sanitation department. I think they put trucks out, these street washing vehicles, but they put chemicals in there to sanitize the streets.
Yeah. We're going to like sanitize the street.
I don't know anybody that got COVID from licking the street.
No, I can remember the taxi cabs in Beijing that have these little stickers, right? This has been sanitized. Beijing taxi cab. Yeah, right.
And they did that again with this. And, everybody had to wipe down the chairs and clinics and stuff. And I didn't want to be disobedient. And I didn't want, it's like it was a scary thing. But from my past experience, I was like, I don't think we're going to get COVID from sitting down on a chair, But, very quickly you could see the fear came, and that's normal. We don't know what we're dealing with. But then over time, the things, maybe it was a few months, maybe 6 months, some of that stuff just kind of went away, which was nice. But it was a lot of panic in the beginning.
A lot of panic in the beginning, understandable because we don't know what it is. And everything we were told was super hypercontagious. I still can't figure out why 6 feet meant anything if it's super hypercontagious, but that's just me.
It was interesting. I remember, I still have it, I think, saved somewhere. Somebody sent me a clip from mainland China. Some scientist there was testing farts. So they had somebody fart through their underwear and pants, and then they somehow collected a sample to see if there was any viral load in the fart gas. I don't know how they arranged that experiment, but that was reported on the news in mainland China. I have a clip of it.
Well, we're laughing in a sense. Well, we're laughing actually. It does go to show like what we're capable of when we're afraid, I think is what it comes down to.
And, I actually really hand it to the people who are the brilliant thinkers and the epidemiologists. It's really fascinating to watch how that all works. Not the people involved in politics or any of that stuff, but the ones that go to the lab and just work these problems out. They're brilliant people.
Yeah, well, they're doing science, which is not great to do in public because usually people have an opinion about something before you get a result back.
That's right. Absolutely.
And with science, you need results, and it takes time. I think what I'm interested in right now, because we could do a whole post-mortem on COVID, but, that's all in the past. What's got my attention right now is long COVID, because I think that's probably the most serious aspect of COVID at this point. Does it kill people? Yeah, it's still going to kill some people, but probably along with the flu killing people. The flu this year was really bad. I don't know about out there, but here in St. Louis, This is not scientific. This is a sampling from my tiny clinic, which sees a very narrow slice of humanity. But my patients this past fall that had COVID, they're like, oh, I got COVID, I can't come in. And generally speaking, pretty mild. I mean, some of them like down for a few days or fever and chills, but the basic stuff, or just sniffles. The people that had whatever the respiratory virus was that was running around in the fall, they ended up with a head full of phlegm that would take a long time to clear out.
It was very thick phlegm that would drip in the back if we're talking about the same symptom. And it was kind of created a sore throat, maybe. There was a little bit of that very thick, continual, kind of a choking like phlegm. It's really difficult.
So COVID has changed dramatically in character as mutable wind viruses do. Long COVID is a thing. And of course, it's in the news. I still know people that are terrified of COVID because, oh my God, I'm going to get long COVID. And you're like, long COVID. And then, cue the horror music effects. But Daniel, is long COVID in any marked way different from any other post-viral syndrome that can happen to some people after a viral infection? Is it really that different?
I've seen some pretty bad cases that I haven't seen before with, just the average flu season.
Okay. I want to know what you're seeing.
I think the most common thing is just a fatigue. For whatever cause, whether in Chinese medicine, dampness or phlegm or qi deficiency or, whatever, that's another thing. But fatigue is always tops the list, and it's really severe fatigue. And I think different patients do have different causes of that. I've seen POTS is a big one. Maybe this is something that we should add to this. And I don't want to get on the bad side of anybody.
Too late. You're a human being and you're stuck in the world of yin and yang. You're going to be on someone's bad side.
Well, I'll be on everybody's bad side then.
Well, you can't do that either.
I just want to preface that I am not anti-vaccine, but I have seen a lot of horrible symptoms coming from people who have had the vaccine. And, I'm not a lab scientist, but almost definitely from the vaccine because of the timing and the repetition of it, getting the second vaccine, the same symptoms come back. Well, I've had POTS. I've had people, basically their life has been, just turned upside down or destroyed because of this POTS. For those who don't know, it's just, the heart rate can accelerate very quickly when you change posture. So from lying down on the bed to sitting up, your heart rate can go from a resting, maybe it's already a little bit on the high side in the 70s or something, can shoot up to 130, 140, 150. One of my patients, he gets into the shower, not so much anymore, it's much better, but it would, just by walking into the shower, he'd be, I don't remember, 150, something like that. Just a really high heart rate. And then the fatigue that comes with this, the chest discomfort and the fear and the, disability that comes with the whole being in the middle of an ocean of despair. So I've had people, I don't want to get too stuck in the vaccine thing.
I would actually like to explore this a little bit, and here's why. It seems, well, the world in general, but our profession in particular, it seems to me, what I understand of it, very much came down behind the vaccine. If you didn't get one, you were damn irresponsible. And now we're beginning to look at some very real effects of vaccine injury. I think it's important that we're able to speak about it. Because if we can't speak about it, we can't treat it. And if we can't speak about it, we can't identify, where did this actually come from? And I think that's important as time goes on. So I'm happy to speak about it. And, look, if people want to write in and tell us a different opinion, that's great. It's good to have a conversation with honest differences of opinion.
I agree. I think the vaccines were necessary and they did, I'm not an epidemiologist, so I'm not in the back room with the data crunching, but I'm sure they saved lots and lots of lives. And I myself, I did get the vaccines, but I did see a lot of people that had side effects. And the interesting thing, this was the COVID in the early stage and the vaccines in the early stage. The medical doctors didn't recognize that the symptoms that the patients were talking about were connected to, in the early stage of COVID, that it was COVID or, the vaccines could have done it. There's kind of a little bit of a blind spot with that. I had two patients, actually very interesting, that had the same underlying precondition. They had too many red blood cells. It's something that some people get, women, I think, more than men. And both of them, right after they received the vaccine, their feet went numb. Their whole leg went numb from the knees down. And it gradually subsided. It took months and months and months with treatment. And then they got the second vaccine. These are very, socially responsible people, I guess we could say. And they got a vaccine again, both of them different, relatively similar, but different times. Got the vaccine again, and their legs numbed out again immediately, like the day after. And so it's very clear that there was some connection with that. But, I think most people just, they get a little side effects, and after a day or two it went away. But some people did get hit by the vaccines for sure. And they should be recognized and not ignored by the community, I think, medical community.
Well, I remember back then, if you suggested that the vaccine could be causing a problem, you could lose your job. I mean, depending on, what part of the media industry you were in.
The history of vaccines is also something that before COVID, I actually read a bit about who is for vaccines and who's against vaccines changes each time it happens. And it's whoever takes it's not even a right or left or red or blue, or it's not even this country. It's, way back even in England at the beginning of the history of vaccines, it's always been this faction against that faction. So I don't think we should probably not get too into the controversy of the vaccine, but it is always a political thing and there is no right side to it.
That's interesting. So controversy and vaccine, if we look at the natural history of vaccines, it's been with us since we've had vaccines.
Yes. It's not a new thing. I'll say one interesting thing about that. I know this isn't our topic of the day, but there was a smallpox epidemic that hit Boston, I think 1722 or somewhere around there. And it was somebody, a ship captain who decided to sneak in without going through the proper quarantine because he had people on board that were sick and he wanted to get his cargo off, and it spread through the Boston, Salem area. And the person who advocated, kind of researched and looked up how to do vaccinations for the population was the very person, the reverend, who was in charge of the Salem witch trials. And so he was trying to save people's lives in this moment while he was, maybe it was like a repentance or some sort. But the history is so interesting. That could be a whole show. But I did see a lot of the long COVID thing, back to that. Definitely a lot of phlegm is a big issue. Foggy headedness is a big issue. And I think the POTS I've seen over and over again. I'm trying to think.
I've seen a number of weird neurological things, just weird neurological stuff. Maybe I'm just being too much of a hammer here because I'm really struggling with this myself. I'm trying to understand it. And I'm not trying to minimize things, but I am trying to understand things. Because again, so often with a pandemic or sequela of pandemic or anything that's kind of running through the social sphere, it kind of catches fire in people's attention and everything else like we've already described. For sure, and I've seen it as well, the fatigue, sometimes even loss of taste and smell or weird, problems with taste and smell that are ongoing and really arduous for people. But back to the fatigue part, and again, it's not to make light of COVID. I'm not doing that. It's to try to understand how this might be in relation to other viral infections that are out there. Look, we know that there's such thing as, chronic fatigue syndrome, Epstein-Barr, things that, back when we started doing Chinese medicine, the Western medicine community basically said, well, that doesn't exist and these people are just, depressed or something. And now we know that there are long-term issues with some viruses. Again, I'm trying to understand, is COVID somehow worse, or does it, maybe a better way to say it is, what's the unique character of the sequela of COVID? And my sense is, in part because people have been using East Asian medicine for a long time to treat this stuff, we might be some of the best people around to help people with this stuff.
If you're able to recognize the symptoms and match it to the right diagnosis and the right treatment, it definitely can be super effective. And we have so many things to work with, right? We don't just have, one pill or this pill or no pill. It's like we have so much in our back pocket to use. But the nature of the disease, I think there's, I don't know, I think it hits different people in different ways, which is always the safe answer to go to. And it's interesting also that you mentioned, Epstein-Barr, because a lot of the people who go to naturopaths, Seattle has a very strong naturopathic community. There is a trend to check for Epstein-Barr, thinking that COVID is triggering an old Epstein-Barr virus to kind of reanimate and come alive again. So that's a big thing especially in the naturopathic community I've noticed is searching for that lost and hidden EBV. I'm not sure myself. I don't know, in some ways for us as Chinese doctors, it doesn't really matter what we call the virus or what we call the pathological agent. It's, if it's this virus or that bacteria, it's really about what we see in the patient, right?
I think it's the strength of our medicine.
Very much so.
We don't have to name the virus. We don't even have to know the microbiology of the virus. We have to know how different kinds of people respond to that particular influence.
Yeah, that's right.
Which isn't so easy.
Yeah, I have an interesting patient. She very, fairly young, 20s, quite healthy, working sports person, very active. And she got hit by COVID and had to quit work, just so fatigued that she can't function. And originally her diagnosis was abdominal, her stomach, just a lot of pain and cramping. And if it was touched very even lightly, it'd be a lot of pain. So it was pain with palpation. For her, it was, I don't know, inflammation is way overused these days, but some inflammatory response in the abdomen, getting in to look at her. And it's interesting, looking sublingual veins and other areas that, different people have different ways to evaluate, but she definitely has blood stasis as a part of her condition. And I don't know if that was pre-existing or not, but that's a big thing that I'm working on. And it seems to be helping a bit. It's not really a dampness. It's more of an inflammation, like a heat, somehow yaming system or abdominal system. And along with that, there's a big blood stasis component.
Blood stasis seems to be something that we were seeing very early on with COVID. And very early on with the vaccine, too, for that matter. I suspect you probably saw women in your practice after getting the vaccine whose period would go haywire for a period of time.
A few. Yeah, that's right.
It was very common. A bunch of practitioners were reporting that. This issue with microclotting and just, something with the, I'm not trying to be inflammatory, no pun intended. But, all the young men with myocarditis and, healthy young men were getting, the COVID shot and having trouble with their heart. So again, there's something here. I'm looking as a practitioner. I'm not trying to lay blame here. I'm trying to understand, what is it about this weird pathogen that messes with the blood?
I think the one disease set of theories is wonderful for that aspect. I think it's the best because they talk about a warm disease, something that happens very quickly. That can, hit you exteriorly or at the top of the body is what, they talk about. Now, if it counterflows, if it goes in the wrong direction, it goes to the heart, right? So, it goes from the lungs right to the heart, which is its neighbor, right? And so the warm disease theory talks, and the blood aspect is the heat going into the blood, right? So you have the Wei level, the Qi level, the Ying level, and the blood level. And it can go from the Wenbing describes how it can go from the most exterior or the superficial areas, Wei level, right? Directly into Ying or blood, and then cause blood clots or hemorrhaging, depending on how things go. And so that method of understanding the disease pathways, I think, was very helpful.
This reminds me so much of something some of my other teachers have said. These teachers I'm thinking about in particular are like a little agnostic when it comes to Chinese medicine. They're not like, well, I'm a Shanghan Lun and everything has to go through the Shanghan Lun. I hold the lineage and everything, everything I see goes through the Shanghan Lun. No, these are people that, okay, what's the right set of filters to use to sort this information through to see how it can be helpful to our patients? You just described beautifully how the Wenbing gives us a way of looking at it and going, oh yeah, it could go very quickly from Wei all the way outside to the Xue all the way inside and cause a whole lot of mischief.
The Shanghan Lun talks about it also, but it's not as direct and doesn't fit as much as I think this pathogen.
Well, how would the Shanghan Lun talk about that?
Well, there's the Yaming, there's Shaoyin, where you have heart palpitations in different areas of the different levels, right? Different sections of the Shanghan Lun, there's heart palpitations. And the one that I think is most interesting in this case would be the Zhuiyin section, which is, often the most mysterious of them because it's so awkward and odd. So Xiaoyang or other places, it talks about Xinji or, words that like the Guiding, Linggui Zhu Gantang or formulas that are for heart palpitations where in how they describe it, like the kidney water is overflowing its boundary and kind of assaulting the heart and causing heart distress. And that works very well, but that's not quite the COVID model. But in the drain section, it uses the word chong, like to surge or to strike, or chong xin, right? Zheng chong. So the xin ji becomes zheng chong, which is I think a much stronger assault or, it's not a baby slap, it's a smack to the head. And I think the drain section has the blood issues as well. It's, drain is pericardium and liver. And so I think that section playing with that in the Shanghanlun does work.
So if you really, really know your Shanghanlun, you could make a case for that then.
Oh, Shanghanlun works perfectly. I mean, I treat most of my patients I treated with Shanghan formulas, at least early stage, but Wenbing also worked really well for this. And it's kind of interesting. Actually, one thing I really thought was, as a practitioner, I thought was very interesting about this particular epidemic or pandemic was that it lasted for an entire year and then another year, right? And then we're into 2+ years now. So the advantage that we have with this as a practitioner observing symptoms is that it's not just something that, oh, this is a seasonal cold, let's use, I don't know, Inqiaosan or Daqing Nongtang or, whatever. It seems to work really well for most of my patients. So we'll call it a winds pathogen or a cold pathogen or a wind cold pathogen or what have you. But what I noticed when I was treating this over the seasons as they changed was the symptom set changed as well. And I found myself being a Shanghan heavy, I'm much more weighted towards Shanghan formulas, and those are my comfort formulas, so to speak. I found myself moving into the spring, that first year, kind of in the spring, summer, switching to Inqiaosan because the symptoms fit perfectly with Inqiaosan. And I was like, wow, this is really calendrically, is that a word? By the calendar, it really seems to have shifted. And then moving into fall and winter, I was moving back to Shanghan formulas again.
That's really interesting. So as the season shifted, it's not that the pathogen shifted, but as the season shifted, you've got the pathogen and you've got the person within the context of the season, and that makes a difference.
From our point of view, yeah, for sure.
I mean, it's one way to look at it.
We have all these variants that, come out, but it doesn't matter, right? We talked about that. It doesn't matter. We have to look at the whole context of it. That's us, right?
It's the thing that I love about the medicine that we practice. It's intellectually very challenging and satisfying in some way when you get it. Otherwise, it's intellectually challenging and frustrating. But it's something that I find fascinating and I love about the medicine, that we can take all these different factors into account. And in fact, it's better if you can.
Yeah, for sure.
And that's the beauty of it. And it's also the thing that makes it so wickedly difficult. You have to be open-minded all the time.
One thing that I always continually thank my teacher for was that he didn't just teach you his method and say, this is all you need to know. I mean, he would always say these are the best methods, of course. Why wouldn't he, right? But, you have to be proud of your methods. But anybody who studied with him had to read everything. If you weren't reading a book, I've seen him kick people out of his clinic. You're not reading? Get out of here. Go somewhere else and study with somebody else. And so, my experience with him is reading the Shanghanlun, reading the Wenbing, reading, all the Japanese formula books from the early 1900s. You always had to have a book there. And so when you have a change of environments, when you move from Taiwan to Seattle, when you go to, I go to Nepal all the time, right? People are different, foods are different, climates are different, altitudes are different, attitudes are different, everything is different. And so I've seen people study with teachers and study very well their methods and then go back home and nothing works because they don't know the stuff behind it. So I definitely have to make a shout out to my teacher, Dr. Lee, for not letting you slack and as a student. But Chinese medicine is so beautiful too. And when I teach, I always tell my students this. It's like, Chinese medicine is, I think, the most powerful in the world because we have 2,000 years of written experience at our fingertips. And if you're able to access them, I think 2,000 years over such a wide variety of, peace and war and, mountains and desert and, all climate warming, climate cooling, everything happened at some point, and they wrote about it, they collected it. And so we can put that on the table and use it if we have access to it.
Having a thriving, profitable practice is one of the most healing things you can do as a healthcare practitioner. Because a robust business is the ultimate expression of vital qi. And that's the heart of our medicine. I'm Julie Bairdontlock, and I help practitioners grow nourishing, profitable, authentic businesses that embody the generative cycle of Chinese medicine. This isn't about all yang all the time. It's about expanding your own internal capacity, growing collaborative relationships with your patients for ethical patient retention, and marketing as an extension of this medicine, not a necessary evil. You already know that everything is connected in your patients' lives and bodies. The same is true for your business. When we align your systems, your schedule, your pricing, and your offerings with you, we create flow, which means more spaciousness, more impact, and more joy. When you are in the flow, fully resourced in terms of chi, time, and money, your business becomes a source of healing, not just for your patients, but for you. Let's grow something rooted, radiant, and real. Visit lifeflowconsulting.com to learn more.
If we have that capacity. So here's the challenge as I see it these days. We've got 2,000 years of clinical history from all kinds of different doctors over different times and different conditions. All right, this may be a little controversial, but what the hell? I think a lot of times we use that as advertising. We got 2,000 years of history. We know some shit. Well, it's been around 2,000 years. It must be pretty good. I don't think it means shit, actually, unless you can get your hands on it. But beyond getting your hands on it, how do you make it alive in this moment in your life, in your practice? That's the trick. Yeah, we've got all kinds of case studies. We have fabulous books, and more now in English than we've ever had. Blue Poppy, Eastland Press, different people, Singing Dragon, all the, Paradigm Press. There's a lot of people over the past 30, 40 years, and all the authors that they've helped bring into English that have brought so much available to us. And maybe it's just me being lazy, but it's one thing to know that there's a ton of information out there, and it's something else for the medicine to become alive enough. I'm going to personalize it in my experience that I can get access to that. And I have not found that to be easy at all. You speak really good Chinese, and you spent a lot of time in Taiwan with a doctor in a very traditional way. So, you've gotten a slice that most of us haven't. So I'd love to get your take, Daniel, on how we take, I'm going to call it the potential of 2,000 years and make it alive in the present moment.
It's a really good question. How to access that? Well, certainly, roll up your sleeves and start writing out some characters and learning. It's not impossible. It's doable. And Chinese gets a bad rap for being too difficult. But I don't think the written language is not as difficult as people want to think it is.
I would completely agree with you on that.
So it's doable. So there is that. It is, accessible. And, you have a lot of translations. That's for sure. But, now you don't have to go to some dusty, library in some, back in some village in China. It's like on the internet, right? You can download almost any text you want in 5 seconds for free. So the accessibility of the text is there. But, you don't have to read everything. First, I think, is having a little bit of confidence in our medicine, having confidence that it is possible to treat disease. It's not just about making people harmonizing yin and yang, and then the disease will get better on its own. We are a serious medicine. You can be a jazz musician and not really play classical music. That's fine. You don't have to play every style of music. But if you play jazz music and you have confidence, you're not just kind of, in your teenage room, just kind of bopping around, but you know that there is something out there that you can get very deeply into, then you have the confidence to actually play and then work on it. And, so I think with Chinese medicine too, You don't have to learn every style and everything, read every book out there. I mean, if you can, that's awesome. You could be a polyglot or whatever. But if you just do what you do really well and have confidence that there is depth to what you need, rather than searching, shallowly but broadly, but really going deep, I think you can uncover lots of stuff. And I see practitioners doing that. They blow me away. It's like, well, you haven't read as much as I've read, but boy, you're treating diseases really well, better than me. I mean, it's the people who have the confidence and have seen Chinese medicine work on patients, not just treating what I like to say, treating the worried well, right? But actually having noticeable positive consequences for people with serious diseases. Then you can start to shift your intention in the clinic and actually try to help them rather than try to prep them for somebody else to treat them.
What do you mean prep them for someone else to treat them?
So, okay, you're here, you have some nausea, you have this disease. I'll give you a little bit of Yaming energy. Make you feel more comfortable, but you're being treated actually in Seattle, like, maybe by the naturopath or by the MD or by, whatever. And that's all fine. I'm not saying that's bad, but the idea by the practitioner that they can't even help them is the problem. And so there's a lot of schools teach that. It's like, you're here to help patients feel better. You're not here to treat patients' diseases, right? I mean, sometimes it's a legal thing that you can't say this, you can't say that, but just internally having the confidence that you can make a difference, I think that's where you start to access the magic of Chinese medicine.
It breaks my heart a little bit every time I hear someone in our trade say, well, Chinese medicine doesn't treat that. Maybe, but my suspicion, at least my experience has been, I don't know how to treat it yet. Maybe I'll never figure it out either, but maybe I will. I think there's a lot that we can treat. I know for myself, it's always dicey in those moments because when someone's not the worried well, when they're actually sick, it means I have to be courageous with my diagnosis. And what I mean by courageous with my diagnosis, not that my diagnosis is right, I hope it is, but most diagnoses are a working hypothesis. Here's what I think I see now. And where the courage comes in is to go, here's the diagnosis, I'm treating the diagnosis. I'm not throwing in a little this because there may be that. I'm not going to, air quotes, cover my bases with this or that. I'm going to go straight at what I think I see it is. Because unless I do that, I can't get the feedback I need to know, was I on target? And if I was not on target, how far off target was I? And I think that's what it takes to actually learn how to be effective. So it takes some damn courage, and not a small amount of it either.
No, absolutely. You're 100% right. And I should, I can always tell myself in the clinic, I should do better. This is not going to work. And let's try something else. It's a problem in our medicine sometimes that we have too many choices, right? And you can see like in the classics, actually, it's very interesting, like Li Dongyuan and all these people, they were all Confucian scholars. And they all, is like this motif, this theme that goes through many stories is they all witnessed like their mother getting sick and dying because all these Chinese doctors were called, famous people were called in, and each of them came and gave a different diagnosis, gave different medicine, and the disease still wasn't cured. And eventually the mother died. So that became the motivation for these people to switch careers, leave government posts and, of wealth and power and learn medicine and then become very famous doctors, with the fact that they didn't leave Chinese medicine. They just wanted to get deeper into it and be better than what people around them were doing. And I'm not sure if I should go further with that, but it's a very interesting historical, for lack of a better word, a theme that plays out as a motivation for becoming excellent doctors. But it's the problem is just that even good doctors, you put, 5 or 10 good doctors, excellent master doctors in a room looking at the same patient, they might have very different views of what that patient is based on their own experience. But as long as they can treat that patient well, then maybe 5 of them are right. 5 out of 10, maybe 7 out of 10.
I think this is a really difficult thing for us Westerners to wrap our brain around, that there's more than one right answer. I mean, that sounds kind of nice. Oh, there's more than one right answer. And I'm not talking about like your truth, my truth, because that's always an opinion. But to actually, I know this has been tough for me to wrap my mind around. There's more than one helpful, I'm not going to say right way, because that's immediately going to take me down the wrong rabbit hole. There's more than one effective, helpful way to treat somebody. And yeah, it has to do with who that patient is. It has to do with who that doctor is, the experience that doctor has had, what they've seen and what they're capable of seeing. And again, it's one of the things about the medicine. It's like, wow, that's really interesting. And oh man, that's really troublesome. Because good luck with evidence-based medicine. And increasingly, our medicine is finding its way into hospitals and, I'm using air quotes, integrative care. I don't even know what that means. Except that we're supposed to have some kind of protocol and some sort of way that can be replicated person to person to person. And East Asian medicine just don't work that way.
Not at its high level. I think the doctors that I've noticed that are very skilled, they're very systematic in their thinking. They're not, 10 different people, 10 completely different treatments, randomly. They do create a system. I think that's the way human minds work at their best. And I'm not so good at this, but when you see people who are able to categorize different things and make models for themselves so that, it may not be the same model as the person next to them, but within their own system, it works very well.
Got it. Okay. That's actually really helpful, that it's not random and it's not just, oh, we have different opinions. These really top-level practitioners, they are systematic in their thinking. However they come to it, they're going to be working their systematic way of doing it. This other high-level practitioner could work really different, but they're also systematic within their approach. And I think it explains why, if you're learning a system of medicine, whichever one it is you're learning, learn the system, like get the system down completely. And don't go riffing on it and don't try to mix it in with something else. And at least not until you can be that sort of boss level practitioner.
Absolutely. It works for music. It works for martial arts. It works for any discipline that you want to get good at. If you want to learn how to be a master Italian chef, learn it really well, and then maybe go on and learn French cooking. I don't know. But once you get the skills of one and you master them, maybe you don't need to go anywhere else. But if you do, you can use those skills to blend into the next area of specialty. But if you're trying to do everything at once, it never is a good idea.
Yeah, no, then you end up with spam. So Daniel, before we wind this down, what would you say your big learning has been from these past 3 plague years? What's it taught you?
Great question. On a personal level, it's, that's one thing. I've been very fortunate that I haven't had too much isolation. My business continued. I was legally allowed to continue my business. So I haven't had that much disruption. In terms of, medically, professionally, I think it's been really a very valuable experience using formulas and seeing them work. And you can tell how they're working very well because there's not a lot of interference with other medical systems, which you get in a lot of patients, especially here in the Pacific Northwest. There's so many practitioners that most patients are seeing are overlapping, right? So, but with COVID, there wasn't much. Doctors were, if you have an emergency, go to the ER room and get some oxygen. Otherwise, there's nothing much I can do. Before Paxlovid came out, but now they're doing that. But before that, which is like a year and a half of this, maybe, there was nothing. It was like 100%. If it worked, it worked. If it didn't, let's try something else. And so that was good. And, you can see these formulas, those tried and true Shanghan formulas, Da Qing Dong Tang, Ge Gen Tang. I actually ended up starting to use Xiao Chai Hu Tang. I'd have to go back and look at all my records, but Xiao Chai Hu Tang became my prominent formula, mostly because we don't have Ma Huang, right? It's not so easily available in the States. So the formulas like Da Qing Dong and Ge Gen Tang and Ma Xing Shi Gan Tang, they're all Ma Huang formulas. So Xiao Chai Hu Tang actually started to use that, and with a lot of modifications. Not a pile of modifications, but significant adjusting to make up for no Ma Huang.
So this was in the early stages or more later stages of people being sick? Because I often think of xiao chai hu tang as something used toward the end to kind of get them out of that in between. I'm not sick, I'm kind of sick, maybe I'm sick, oh, I'm sick, oh, I'm not sick, that back and forth. Were you using that earlier on?
I did for some people. I adjusted it. Ginger was a big addition. I mean, it's already in there, but became a prominent part of it.
And that's for releasing the exterior in the way that Ma Huang would have.
Right. I added guizhi into it also. So it became kind of like a chai hu guizhi tang. So that actually worked really well. But, there were a few patients that I treated right at the beginning, and I used a very strong dose of guggen tang. I think guggen like 20, 30 grams, 40 grams. And then guizhi probably 20 grams. I'd have to go back to my records. But, not 6 grams or 9 grams, but, put some meat on the table, so to speak. And then by the next morning, they were good. It was very rapid, very fast changeover. Xiao Chai Yu Tang worked very well, very flexibly for a lot of people, but certainly not for everybody. People with coughs, Mai Men Dong Tang was very useful. I have my go-tos. It's like, you grow up with toast in the morning. So when you need to reach for something, toast is your comfort food, right? For me, those formulas are my comfort formulas.
Well, like you were saying, you learn something systemically. You understand it systemically. And then you can do all kinds of things with it because it's all within your wheelhouse. It's like, remember back in the old days, Mission Impossible for Tom Cruise, where, there'd be like, here's your mission, blah, blah, blah. And then he'd like, go through the different pictures. Well, I'm going to have the guy who knows electronics, and I got the guy who, knows how to, social engineer his way into an elevator and, whatever. And so you got formulas that do that. You know your team. When you know your team, you can do a lot with them.
That's right. That's right. You can start to move within those formulas and create a lot of effect if you know them very well. You don't need to have a million formulas in most cases.
Have you found that as time has gone on, you use fewer and fewer formulas and fewer herbs? Or you just stay with your team?
I'm going to say yes with a no on the side, because one of the problems with using a formula that you know really well, even though it works, is that there's always something else out there that is interesting to try. And so every now and then, or, you're reading, you sit and you read somebody's, case study or formula from, whatever modern or classic time. You go, oh, that's really cool. And I have a patient that might fit. And so you use it and give it a try. So my formulas are relatively consistent, but they do morph over the years. I've added herbs in and tried them, and sometimes they work really well and I'll keep them. Sometimes they don't. And then I have like an extra bottle sitting on my shelf for 30 years, not that long, but you know what I mean, right? Then I try something else. And I've seen that with the good teachers, they have the formulas that are just their standards, guizhi tang, yin chao san, whatever it happens to be. Those are the go-to ones, shangxia liu jun tang. But then all of a sudden they start to use something different. And I've seen Dr. Lee do that. He'll add something in that he never did before. And then he'll use it on all these patients for like 2 or 3 months. And then he starts to hone in on like, oh, it's good for this type, but not for that type. And then he starts to pull back. And then you see kind of winding in and out a little bit. And then, become established as, okay, this is what this is for.
That sounds like a good prescription for learning how to make prescriptions.
Yes. Yeah. So I'd like to say that, this box works for this patient and that's always what I'm going to give. But, it doesn't always, and you have to be ready to shift gears sometimes, try new things.
Well, maybe at some point we'll could sit down and do an episode on Daniel Altschuler's greatest hits, the formulas that you like to use and use them a lot, the sort of go-tos. I mean, everyone's got go-tos and, but I'd love to have the conversation with you, not because, oh, hey, here's some go-tos and y'all should use those because they're Daniel's go-tos, but because, to hear your thinking behind them, because that's the interesting part.
You're right. That is true.
It is. It's the fun thing.
I'll have to get some thinking before I do that interview.
Yeah. It's a good idea to think, but maybe not too much. Well, my friend, as they said here, as they used to say on car talk, well, we've wasted another hour.
The only waste about it is that we weren't actually having some tea, which is the way I like to talk with you the best, Michael.
I'm hoping to be able to bring the kid and the family out to the West Coast this summer, and we can have tea and cookies. All right, my friend. Always great to hang out. Thank you so much for the little jaunt today with COVID.
Thank you for inviting me on this wonderful geological podcast. It's really amazing. Thank you.
It's easy to imagine that we know something about treating epidemic disease because we have thousands of years of documented use of herbal medicine to treat these kinds of troublesome infectious issues. But having the instructions for something and having the know-how are two very different things. And with any challenge, it's an opportunity to distill some clarity and to get better at what we do. Well, here we are at the end of this episode. If you've listened up to this point, you're either a rabid fan of Geological or the forward button on your podcast player stopped working. If you are indeed a fan of the podcast, you can help us to bring new episodes to our community of practitioners by supporting us with a membership or a one-time contribution. Details, of course, are on the website. That's it for today, friends. Join us again next Tuesday for another thoughtful episode of Geological.